risk of mild malnutrition, sir?
Yes, risk of mild malnutrition. Okay?
Yes, sir.
Nako. Oo, so in other words, dapat ang health worker or the health worker or the individual or the team is already like, oh my gosh, the patient or the client is already at risk of malnutrition, which is mild. Nakuha?
Yes, sir.
All right. Sa percent IBW class, 90.16 man siya.
Same lang gyapon, sir.
Same lang
Risk of
gyapon,
mild
no?
malnutrition.
So, yes, mild malnutrition gihapon, no? Okay. So, then, na-assess naman mo siya, therefore, you have to do something. After that one is, ano ka na, gagawa ka na ng nutrition diagnosis. And following that is nutrition intervention. Okay? All right. Next is, okay, ang next slide, okay, percent weight change. Pila ga ito yung percent weight change?
4.22, sir.
4.22. Okay, 4.22. Okay, 4.22 ang 1 month. Asa siya dapit?
So, severe weight loss.
Okay. One month lang man.
Ah,
Significant weight, yes, significant lang siya.
mm, okay.
Okay? Pero kung
Yes,
for example, 1 week to siya nawala, for example, di ba? Ang usual body weight niya is 59, tapos nahimo siya 55 in just 1 week's time. Okay? So for example, kunyari ha, dili siya 1 month. So paspas kaayo nagbaba ang iyahang timbang. Okay? Let's change it to, for example, 1 week. So what would be the interpretation now?
severe weight
Si
loss, sir.
yes, severe na siya na weight loss. Okay?
Yes, sir.
All right. So nakuha ninyo na.
Yes, sir.
All right. So you have a guide here already. So this is how we assess no whether there is nutritional risk. So these are the ways we determine kung merong nutritional risk ang pasyente or client. Nakuha?
Yes, sir.
All right. So next. Okay, so there's also biochemical data, biochemical plasma proteins, albumin, transferrin, p-albumin, urine samples, no, laboratory values, which I actually, did you receive the one which I sent you sa group, sa messenger?
Yung picture, sir.
Oh, yung picture.
Yes, sir.
Tapos unsa ang iyang indication, unsay meaning niya? Possible. Di ba naa didto? Okay?
Yes, sir.
All right. So that's biochemical data. I will not explain that further, ha? Okay. Physical examination requires skill and clinical judgment, need for dietary and laboratory data, clinical signs of malnutrition, hydration state, and functional assessment. Okay? All right. So, yeah, no, these are the clinical signs of nutrient deficiencies. I will not discuss about this anymore. Okay? So, kasi na-cover na natin ito sa clinical assessment. Okay? All right. So, next is Okay. So say for example, eto, skin with this decreased turgor remains, can you see the slide?
Yes, sir.
Okay, remains elevated after being pulled up and released. Okay? So, pag ing ana ang mahitabo class, if that happens, meaning the patient or the client could be suffering uh, from dehydration.
Mhm.
Nakuha?
Yes, sir.
Oo. I-try daw ninyo inyo ha.
Dili.
Mubalik
Mabalik
man
man,
siya
sir.
mubalik man siya dayo so dili mo dehydrated.
Yes,
Okay?
sir.
All right. So, next. Okay. So, ayan. Dito na tayo sa documentation using nutrition care process because we really need you here. Okay?
Right.
Class, kailangan talaga namin kayo dito. Okay? Sa nutrition
Yes,
care
sir.
process. Okay? So, assessment, diagnosis, intervention, monitoring, and evaluation. Okay? So, ADME. Okay? Or NCP. Okay? Nutrition care process. Alright? So, kailangan namin talaga kayo, no? So, assessment from chart review, kanaganing sa mga chart, no? Sa chart,
Patient's chart.
patient's chart. Yes, correct. Patient's chart, no? Um, Patient or family interview, and then conduct anthropometric, biochemical, clinical, and dietary assessment, and also medical history, and also psychosocial data. Okay? So that is how we do it. Okay? Tagaan ta mo og sample unya sa forms. Okay?
Yes, sir.
All right. Next is okay, diagnosis. Okay? When we do our diagnosis class, this is how we what is a nutrition diagnosis? Okay? Nutrition diagnosis is where nutrition problem is identified with supporting evidence. A nutrition diagnosis is a clear, concise statement of nutrition diagnosis or diagnosis. Pag isa lang, diagnosis, meaning SIS. Pero pag marami kang ma-identify na diagnosis, ES siya. That's plural
Mm,
form. Okay? So
okay.
this is written in general, in the general format. So how do we do it? No? Class, we cannot, kami mga dietitians or even nurses, we cannot diagnose na kanaganing unsay sakit. But we have, ang mga nurses, they have their own nursing diagnosis. Ang dietitians also, we have nutrition diagnosis. Dili na mo pwede kopyahon ang diagnosis sa doktor. Nakuha ninyo? So, dili mi pwede mag-ingon na, okay, the patient has type 2 diabetes, or the patient has cancer, or the patient has um, renal disease, for example. Dili mi pwede mag-ana, magbutang. It is the doctor, the physician's work. Nakuha?
Yes, sir.
Okay. Dietitians do this, the nutrition diagnosis. So, nutrition diagnosis or problem, okay, related to, uh, always na siya class, related to, then what is the etiology or what is the cause? Okay?
Yes, sir.
Nakuha? Then, evidenced by, what is the signs and symptoms? Nakuha?
Yes, sir.
Okay. So just remember, P PES. Okay? PES, meaning, ang statement na mo sa nutrition diagnosis is PES, SS, or PES or PES or PESS. Okay? So, P stands for problem. Nakuha?
Yes, sir.
Then, followed by etiology. And then, signs and symptoms. Nakuha?
Yes, sir.
Okay, so problem related to etiology, then evidenced by signs and symptoms. Example, for example, um, okay, for example, class ha, uh, for example, okay, for example, weight loss, that is the problem. That is the problem that we have identified or diagnosis based on the computations. Katong percent usual body weight, percent weight change, there is weight loss. Nakuha?
Yes, sir.
Oh, tapos, related to, nakuha?
Yes, sir.
Okay, ang etiology, what could be the cause? So, mag-ano mi ana, mag-ano mi cause, no? Through interview, no? Tapos, through observation, related to chewing difficulty with meal refusal. Kaya ang pasyente pala or ang client namin, lisod di ay kayo, for example, HIV AIDS ang pasyente. Tapos na siya ka ng chewing difficulty kay na sores, mouth sores, no? Tapos wala siya gana, kaya nagre-refuse siya ng meal. Kaya dietary assessment yan siya. Through dietary assessment. Nakuha?
Yes, sir.
Okay. Then, evidenced by, kanang naka-highlight, naka-bold o naka-highlight. Nakuha?
Yes, sir.
Okay. So, what are the signs and symptoms to justify as an evidence to weight loss? So, evidenced by 10-pound weight loss in 30 days. Example lang yan siya. Nakuha?
Yes, sir.
Yes, sir.
Alright. So, that is now our nutrition diagnosis. Gets?
Yes, sir.
Okay. Now, there are times na when we go back, no, you cannot find a nutrition diagnosis. So if the patient has with no nutrition problem that warrants nutrition intervention, kasi dapat every day yan siya, no, nag-add to me sa mga pasyente. The words no nutrition diagnosis at this time may be documented in the medical record or sa chart. Nakuha?
Yes, sir.
Alright. So, kailangan na mo gyud mo diri, no? So, intervention, so na-identify naman to, no? So, to intervention, so ano na, meron na kaming plan, nutrition care plan, okay? Then, to address nutrition problem or nutrition diagnosis include we have diet prescription, okay? Kung normal diet ba, kung for example soft diet ba siya or NGT ba, kanaganing ang tube is para sa ilong, ibutang sa ilong, padulong sa stomach. Okay? Nakuha ninyo? So, depende
Yes,
sa
sir.
among depende sa intervention. And then recommendation and then implementation. So goals are developed and the patient is involved in the goal setting process. Education and counseling are documented in this section. Okay? So that is for nutrition intervention. Okay? Pero that's just a snapshot, ha? Okay. Next is monitoring. So monitoring of progress to see whether goals or objectives are met. Monitoring procedures may include regular weight checks, okay? Review of biochemical data, kung nag-improve ba ang blood sugar, for example, nag-improve ba ang say kaning sa iron status like the uh, uh, kining hemoglobin, for example, meron bang improvement sa hemoglobin or sa potassium, blood potassium, nag-improve ba? So, i-monitor na muna siya kung changes. Okay? Then, compliance with diet recommendations. Kung ang diet ba nag-improve ba yung food intake, dietary intake records, tolerance diet, nutritional supplementation, and tube feeding. Okay?
Yes, sir.
All right. Then, next is evaluate. Evaluate the monitoring procedures. This section procedures outcomes relevant to nutrition diagnosis and intervention plans and goals. It compares current findings with previous status or reference standards and determines factors that help or hinder progress. Okay? So evaluate na mo. Like let's say for example, dili na nag-cooperate ang pasyente. So evaluate na mo ang process, no? Or say kulang ang kulang pala ang plano, hindi effective. Then after the evaluation, we go back to assessment. Kaya if you notice, cycle to siya. Assessment, diagnosis, intervention, then monitoring and evaluation. Nagets? Hello?
Sir?
Yes, o nakuha?
Yes, sir.
Okay. Okay. So, um, just remember, if you're objective ka, no? If you're objective, you can never go wrong or right and consider it done. Okay? So, dapat we have to write it down, no? Tapos, for documentation. Okay? All right. So, what time is it? It's 9:36. All right? It's 9:36 class. Okay.
Ano, wala.
I believe can you check your Google Classroom?
Yes, sir.
Yes, oo. Ah, kanang gi-post na ko at 8. Can you see the screen pa rin?
Yes, sir.
Okay. So 8:08 a.m. So na ako upload din ha. This is for 2019. Actually bayaran na ako ni siya sa Kuan class no kay I paid $100 for this no to be able to get a from the US no. So kana makita ninyo
Yes, sir.
meron siya mga terminology. Oo. So yan siya. Okay? So I'm sharing this to you. Ayaw lang ninyo i-share sa uban ha kay okay, I'm sharing this to you okay? All right. So, naapoy mga videos dira class para mas masabtan ninyo ang nutrition care process. Okay?
Yes, sir.
Alright. I do not know kung mag-work siya ha. Can you hear the audio?
Mm, Dili, sir.
No, sir.
Dili ninyo. Sige lang, sa inyuhan na lang mag-ano ha, kamo na lang mag-ano, kamo na lang mag-watch sa video.
Okay, sir.
Okay. Okay? So, there are actually 15 videos. Okay? So, about nutrition diagnosis. Nutrition care process. Okay? Class, okay. Gusto na ako magpakita sa inyo ha. Magpakita ko sa inyo ha. Okay? Kasi I posted something, okay. I posted something about how, okay, wait. Okay. Can you see me?
Yes, sir.
Okay. I posted something in the Google Classroom asking you if how long will it take for you to uh, develop the system or the software or an app. Depende.
Depende, sir.
Depende sa requirement. Okay. Have you thought of a an app already or mm, an app or a system or a software na i-develop ninyo?
Murag, murag
Wala
wala.
pa?
Wala pa, sir.
Hmm. Okay. All right. Is there a change sa, for example, katong previous, di ba? At the start of our meeting for this class is that I ask you if you have already in mind a a software, an app, or a system na uh, gamitin, na gagawin or i-create. So, are there changes? Ay, kinahanglan ako mag-change. Kanang question na ana ba? Knowing,
Magbuhaton, sir. Maglisod pa, sir.
okay. All right. Okay, sige. Hmm. What what do you think is the easiest? For example, in your level lang muna. App, app, system or software. I do not know unsa na inyo ang mga kuan oy. Unsa nang inyohang mga kuan. Actually, class, na ano my gosh, unsa una ko pagtudloan ning nutrition fundamentals tapos isa lang siya ka subject kung dili man ako matudlo tanan oy kay naa pa man na actually class naa pa may public health, naa pa may kanang sports nutrition, napa may food service, napa medical nutrition therapy. Medical nutrition therapy, like let's say for example, discussing about diabetes mellitus. Okay. App or software, according to Gene. App or software is, wait, sa to. App or software na mag-calculate tracer. Okay. So, ing ana lang, Gene.
Murag anak, sir.
Okay. Alright. So, mas dali sa inyo ha. Mga how long kaya do you think na matapos niyo siya? Oh gosh! 2 to 3 months! Oh my gosh! Ah, okay. Hala, dugay-dugay ko di ay. Hala. Okay. Sige na lang. I will not expect you to, I will not expect you um, to do it, no, or to submit something like that. Pero like, let's say, for example, mangutan ako ha, you know already how to use the food exchange list, correct? Ha?
Sir. Yes,
'Di ba
sir.
kabalo naman mo, no? Oo, tapos meal planning.
Yes, sir.
Complicated siya.
Me- Medyo, sir, pero
Med
for magets man, dugay-dugay.
Pero okay, question. How long do you think na yung particular project na yon will be finished?
Ang unsa, sir.
For food exchange list na dili gani siya manumanuhon, dili gani siya kanang siya manumanuhon kay to
1 year, sir.
1 year. Mm, okay. So 1 year day siya, so dugay gyud day siya. Pero at least you have an idea already.
Yes, sir.
Oh, okay. So dili din na siya pwede na kuan next week na ana dayon.
Dili, sir.
Pwede po siguro katong percent kanang kung computation lang, for example, percent weight loss. Pwede siya i-capstone. Ano na lang siguro ang ako ang kuano? Okay, tama ka Jean, no? Ano na lang siguro ang ako ang i-require sa inyo ha. Kasi since I've started asking you kung unsa ang inyong pwede pwede himuon na for capstone. Kanang tuan lang siya, proposal lang siya, na title lang siya. Ana, what do you think? Title lang siya. No, ana na lang siguro kay I cannot demand na dapat matapos nyo kay di po siya. That's why I was asking in our Google Classroom how long siya matapos.
Mm, yes, sir.
Okay? Oo. So, today's class ha, ang Philippines manggod with sample prototype guro, sir, pwede. Okay, with sample prototype. Okay. Okay, how long po ng mga sample prototype, Jean? Ang prototype, what do you mean by prototype? It's just the flow or kanang pictures ra.
Ang
Oh,
flow lang sa application, sir.
ang flow lang sa application.
Yes,
Okay.
sir.
Ana na lang siguro ang prototype, title, mag-post ko dito ha sa Google Classroom tapos as TLA tapos title of the for example title of the capstone tapos for example sa may what do you what do you prefer individual sa man ang capstone ninyo.
By group, group. By
Group,
group.
sir.
Group,
Group.
sir.
Okay, per group siya. Pero i-post ng gihapon ako siya dito. Okay, group of 3. Okay, so i-post ng gihapon ako siya dito. Tapos, um, meron siyang title, proposed na title sa capstone. and then merong prototype. Kaya ba yon?
Pwede, sir.
Sir, exam naman to,
Okay.
sir.
Ang scope sa day, ano
Ah,
naman, sir?
hmm. Pwede
Exam din
siguro,
ito, sir.
pwede siguro i-submit. Kanus what do you think? Ang suggestion ninyo?
Final, sir.
Ang
Exam din
finals
ano, sir.
exam, sir.
With prototype na,
Final
sir.
exams?
Yes, sir.
Yes,
May
sir.
prototype siya.
Yes, sir.
Mm.
Nya i-discuss
Mm.
discuss lang, sir, ang ideas sa imo, sir. Wala dyan po siya
Um,
capstone, pero exam na siya, sir, na naikuan.
yes, sir.
Oh, so instead na magawa ako ng, for example, magawa ako ng uh, test for finals,
Yun na lang
eto na yon.
prototype, sir. Yes,
Yes,
sir.
sir. Good output po siya, sir,
Proto
kay kung unsa man ang nahibal-an na mo sa imong sa subject, sir, mabuhos na mo dito na capstone, sir. Ma
Yes, sir.
ma-base nimo ang
Oh,
Apply na mo siya,
information,
sir.
sir.
okay. All right. Sige,
Yes.
we can do that. Pero ang presentation nato is during that examination day.
Yes, sir, pwede, sir.
Pwede.
Or kung kuan,
Do
sir,
you have
mag-plan ka og days, sir, na maka-present si mo, sir.
okay. I prefer siguro during the exam day siguro or ana na lang. Oo, ana na lang. Oo. Tapos, i-record lang siya, Jean, palihog. Ikaw ba itong nag-record, Jean? Oo. Tapos, pohon, let us see kung what we can do, no, about it, no. Um, kung unsay pag-improve ana what I just would like to know is unsaon siya pag ano ba kanang naanamoy ka ng concept no ana actually gwapo pud na siya na kuan na
Yes, sir.
exam no dili na ko atong mga essay wala na oy kuan
Okay,
na
sir. Okay
kana
kayo,
na
sir.
siya kay ha
Okay kayo, sir.
Eldon
Pwede po siya ikuan. Pwede mo siya i-push para sa fourth year na mo, sir, na kuan. Capstone para improve na
Ang
education, sir.
proposal,
okay
sir.
Yes, sir.
tama practical siya no okay so I should ask, no? It's 9:50, wala pa may ano 10 o'clock. I should ask, um, what did you learn about ano? Actually, there are so many things that I would like to teach you pa about nutrition and dietetics, no?
Tayo, sir. Dagan
Ah,
jud kayo.
ha?
Dagan
Daghan?
jud kayo. Yes, sir. Dako pa jud ang scope sa nutrition dietetics, sir.
Yes, that is why strict to jud ko sa akong mga estudyante kas. Kaya mag-take og board exam, my gosh, dili gyud pwede mo na ko nga dili pwede mag-uyab-uyab, dili pwede mag sorry ha. Strict jud kay ko sa nga tanan, super kay ano gyud kana
Eldon, sir. Uya po yan.
Wala gud,
even
sir. Wala gud,
during
sir.
the review. Oo, so now you understand what we do already,
Yes, sir.
no? Oo. So in fact, no, I even asked your dean is actually a good friend of mine, no. Tapos I even told him, eh, kanang gusto ko mag ano mag tudloi ko ng programming. Dugay man putay ng programming, 1 year man daw na. 1 year?
Dagan pa
Uh,
jud ang kuan, sir, sir. Depende sa
Ha?
language na imong tun-an, sir. By language
depend,
mo gud ang programming, sir.
Oh, okay. Kasi we can work together. Okay, question is it really possible na we can work together?
With
man, sir.
collaboration with the nutritional dietetics students, sir, and
Char.
IT.
Yes. Oo, oo.
Aray.
Pwede,
Yes,
sir.
sir.
Pwede siya, 'di ba? Okay. All right. Thank you, Jonas. Thank you, Jean. At pero tanang na schedule gyud ihatag, sir. Yes. Correct. Tama ka, Jean. Okay. All right. So that is actually what we do, class. Daghan pa kaayo class, no? Actually, naapoy ka lang sa sports nutrition. I'm actually teaching sports nutrition right now. No, naapay nutrition assessment. Imagine amo ang uban sa amo ano, class kay kanagay nagapapil-papil pa. Although naa naman po'y uban na mga um na naman po'y mga software uban, pero kanaganing um tapos ibutang na lang pero Excel type siya. For example, oo, Jean. Mm,
bro.
oo. So, now is I am going to share to you some of the ano na lang muna class ha. I am going to share to you some of the napamanta isa ka session no
Sir, Wednesday, sir.
sa Wednesday no before the exams no. Okay. So anyway, ang exams lang naman is kung for example ha sa inyo ha, I do not know kung mag-specialize ba o for example ang inyong topic is about pregnancy, 'di ba? Pregnancy or for example infancy for example, 'di ba? So I do not know kung kuan pa kay siya daghan kaayo mig scope pa. Imagine I was trying to to teach you ang coverage niya is since first year up to fourth year up to mga ana up to fourth year na kuan nga topic. So by the way, naana mo'y grupo
Para sa asa, sir?
para sa kuan kanang capstone for example.
Wala pa, sir.
Wala pa, sir.
Summer class pa na siya may balaan, sir.
Wala pa. Oh, wala pa, Jonas. Okay. Sige, later na lang. Anyway, ano lang man, practice lang man usa ni no. Angelo no. Um, hmm.
Unsay plano
Would you
din
like
mo,
to
sir?
choose your own? Hindi, para sa ano ba? Para sa Juan Eldon, para sa final exams.
Yes, sir.
'Di ba?
Opo.
Title of the tawag nito? Title
Capstone,
of
sir.
the capstone. Tapos unsa to? Katong pictures
Prototype, sir. Prototype, sir.
o prototype. O prototype. So, what would you rather choose your group mates or ako ang mag grupo-grupo sa inyo ha? Choose na lang. Okay? Choose na lang kayo. Okay? Alright, sige, sige. Discuss it among yourselves, ha? Alright, so time is 9:55. Okay, 9:55. So from 9, I will give you sa kuan from this time up to 11, 10 to 11 is that you choose your group mates tapos pila ka members sa group, sir? Tagtulo? 3? Okay. All right. Kay 27 man ta kabuk. Okay. So tagtulo. Okay, so 9, 18, 27. So nine groups lahat. All right. Sige. So, I will give you the time to choose your group mates, no? Tapos prepare the presentation. Prepare the presentation tapos title mag-brainstorming kayo ngayon. Okay? Tapos show me the prototype. Tapos ato
Kailan nga
ang
may
i-ano,
presentation, sir?
sa exam day na lang dong.
Okay, sir.
No, exam day na lang siya. So, but if you can make a, for example, unsa na niyo pa-present ka ng video or
Share screen, sir.
share screen na lang?
Yes, sir. With the all
With all the
information.
presentation ganun.
Yes, sir.
Okay, sige. Pero if you can be creative also of how you're going to Jonas pwede ra pud video, sir. Powtoon? Unsay powtoon?
Powtoon, sir.
Wow.
Powtoon. Unsay
Yung
powtoon?
sa yung gina-display good sa TV sa pag magpasok ka sa library, sir.
Oh, okay. Pero na siya audio,
Yes, sir.
animation. Okay, animation Gene. Okay. Pero na siya narration. Okay, Jonas. Okay. All right, I got it. Powtoon. Oh, thank you ha. Thank you for the term. Okay, bago na siya sa ako ah. Wala ko kabaluan ha. Yeah, you
Yes,
ask
sir.
me anything about nutrition and dietetics, I'll answer you about food. I'll answer you pero kaning sa ako and oh my gosh, wala ko kabalo. So thank you. I'm learning from you. Okay? So ana na lang siguro. So it's either mag-live mo katong share, of course, share screen. Pero it could also be na i-upload ninyo katong sa YouTube gani. Sa YouTube tapos um
I-present.
tapos present na yun. How long do you think is the presentation per group
Mo
1 hour, ay
of the
30
PowerPoint?
minutes to 1 hour, sir. Ang pitching na, sir. Okay, I'm sorry with the explanation. Ang madugay-dugay lang ana, sir, kanang kuan lang, kanang questioning lang, sir, kana, sir.
question and answer lang, sir. Pero pag mag-present ka,
Okay.
mga 5 to 10 or 15 minutes, ganun.
Katong Powtoon, 5 to 10 minutes.
Yes, sir, yung pag-present sa prototype, sir. Yung sa presentation.
Okay. All right. Sige. Okay. A minimum of 5.
Sir, nawala ka, sir.
Nawala si sir.
Huwag nawala si sir.
Smooth lang ang cares na pinapasok, may pasok.
Sabadan, uyab-uyab ya ka.
Wala.
Ay, asa siya?
Ha?
Ay, naman di siya di ay. Hi.
Pag-hi daw, pag-hi.
Uy, banluta, pamati.
Patay. Live gani na yun sa, ay,
Wala mo
again.
sa manual.
Ano na lang, number 7.
Okay lang daw late.
Ha?
Yun
Okay
sa
lang daw
yung
late.
kuan, test 2D, ay activity 2D.
Sa ganina?
Atong pangalan, uy.
Ah,
Mga
wait.
bata.
Ano?
Titray
Sa
niya.
lang?
Sumpay man to.
Mangita kag tulo ka bata doon.
Mo gani.
Pangit,
Nya, asa mo
pangita na ito mga
basta
bata
doon?
doon.
Mangita
Masuko lagi ka, Paul.
sa gabi eh.
Yawa, nagita kagabi. Paul, mga
Wala
bata.
ako
Ay
nagbutan.
mo, lahi na yung mga grada mo
Reported,
sa
reported man din eh.
gabi na ka magitag bata. Ha?
Oy, dismiss na daw.
Answer mo dara be.
Oy,
Oy,
be, wait lang.
na kay Angelo. Ay, kuan. Add lang sa group chat. Nagkuan ko. Answer. Ang
Dito
uban
ka,
naman
dito.
kay kuan.
Uy, share mo answer.
Matay mo answer niya.
Uy, GC.